My name is Mainat Abiola Fagbemi. My student ID number is N41381730. This presentation will carry out an exploitation of COVID-19 impact on mental health and the influence that is will have on social improvement. It will explore how key perspective will have an impact on the delivery of care, the potential outcome, so that disruption in mental health services can be maximized based on COVID-19 will be explored. In this presentation, I will discuss about mental health statistics UK, mental health and COVID-19, the negative impact on mental health arising from COVID-19. I will also discuss the service improvement, tools to improve service improvement of COVID-19 and mental health. Mental health problems are common, whereby 1 in 6 adults will make a report of common mental health disorder, which include anxiety. Within a week, PHA 2019, there are many more than 551,000 people in England who has severe mental illness such as bipolar disorder, schizophrenia, PHA 2019. Mental health and COVID-19. Studies have shown that COVID-19 will have effects which are long-lasting on mental health, which is both direct due to infection and also indirectly as a result of isolation. There is a need to identify intervention so that those effects can be mitigated against people from BAM community are at risk, which are higher of contacting and also dying from COVID-19. Older adults, especially those in isolation or who is experiencing cognitive decline such as dementia, can also become more angry, anxious and stressed. Negative impact on mental health arising from COVID-19. Public Health England. COVID-19 has negatively impacted on people who are experiencing mental health illness. COVID-19 has resulted in many services being reduced, so as where people with mental health illness can access people with many of these services being provided over the phone. This has resulted in an increase in social isolation and an increase in mental health illness, especially as a result of lockdown and increased financial stress and fears, but also as there are lack of earlier detection, as many of the services has been reduced or have been shifted to the online means. Service improvement. COVID-19 has halted or disrupted critical mental health services in UK, and many other countries globally. The COVID-19 pandemic has had significant impact on population, mental health, and the need for mental health services in many countries, while also disrupting critical mental health services and, and capacity. As a response to the pandemic, mental health providers were asked to reconfigure wards to accommodate patients with COVID-19, thereby reducing capacity to provide mental health services. This is likely to have widened the existing mismatch between demand and supply of mental health care in England. NHS. We qualify the impact of those rapid services reconfiguration on activity level of mental health provider in England during the first 13 months of COVID-19, from March 2020 to March 2021 of the COVID-19 pandemic. We use monthly mental health services utilization data for larger subset of mental health provider in England. On the other hand, demand for mental health services are increasing. WHO, the World Health Organization 2020, the pandemic has exposed social and economic inequality which will impact on vulnerable population such as elderly, young frontline health workers and BAM groups. Tools to improve services improvement. The tools to improve services improvements are such as shared decision making, where you involve the service users within the care. The service users within the care and the people that are in the service user that are going to care for the mentally challenged people. Those involve services used within the care JIAL 2020. Also, to improve the the tools to improve social improvement is also when they empower individual, like the people that work in mental health home, the way they empower them. Mind 2024. Also, you can educate to support the Resilience and Recovery Mind 2024 Care Act 2014. Care Act indicates that all local authorities must carry out the needs assessment before creation of the care plan. When the care plan has to be created, they need an assessment before they can create any of the care plan. The Care Act 2014 that indicates that all of the local authorities must carry out a need of assessment before any creation of care plans. Also tools to improve service improvement, like shared decision must be taken. It involves the services users and also the people that looks after the mental health care, and also educate and support the resilience and recovery of the mental health and COVID-19. In conclusion, service improvement is an important aspect of care provision. there is a need to improve ways in how service is provided. And also, COVID-19 will have a negative impact on service improvement and service quality, as less services have been provided while demanding in why demand is increasing. In addition, recommendation is to improve knowledge for early recognition, management and management and assessment of mental health illness, signpost mental and physical health needs of patient, breaking down the barriers of inequality which exists so that health health outcome in can be improved in mental health care.